evening, everyone. This is the Health Seniors Human Services Youth Education Human Rights Committee meeting, the monthly meeting. My name is May. I'm the chair. We have a number of agenda items, to go over today and presentations. But before we start, we do need to take the roll call and approval of the minutes. So, Indrani, can you start with that?
May Lee, here.
Here.
Larry Finn, absent. Tom Bowie, absent. Eric Diaz, here. Tanisha Fields, here. Naguma, here. Let me see that. Annika Carr, absent. Wavin, absent. Indrani Nicodemus, me here. Arnett Scott, absent. Carmen Perez. She called me first.
Oh, she called you. Oh, you went, okay. All right, great. So we will, okay, so just about the minutes, I did email them out. Are there any changes, additions? Okay, so then they are approved. Okay, so we'll start with the first agenda item. We have, an informational update from Ryan Health. Michael Fagan, are you going to be speaking?
I'm not going to be speaking. It's going to be Dan and Dr. Lynch.
Okay, Dan and Dr. Lynch.
Hi.
Okay, so just so you, just a little bit about our procedure, I think, so you speak, and then we take questions and answers afterwards. It's all safe after your presentation. Okay, and then, members or whoever's here will raise their hands. I will call on you and you will get to ask your question or address them. And, Alicia, you will let me know if there are people in the Zoom who raise their hands and they will get to speak to.
Do you want to maybe just announce for the people on Zoom that they should raise their Zoom hand if they have a question?
Okay, yes, for those of you who are on Zoom and you wish to be, get our attention or speak, you should raise your Zoom hand. Okay, that's what we're going to be watching for. Okay, please go ahead.
How much time do we have?
Okay, do like 8 minutes and then the questions and answers usually elaborate more. And then when you answer them, you'll be able to speak more to what we need or want to know or
Yeah.
what, what's important.
So first of all, I want to welcome everyone to what we call Ryan Nina. We are very, very excited that we're hosting the committee this evening. It is part of actually one of our strategic plans as a community health center is to move beyond who we consider just a doctor's office or a provider of medical services, but also to be a community wellness center. So part of that means is to engage the community around services beyond what we traditionally think is medical services. We're going to talk a lot about that because we are a community health center. But so just by being open in the evening and hosting community meetings, that's one of our goals as we move forward. We want community members who have lived 2 blocks away for 50+ years and have never been inside or are unaware, because we want you to tell your neighbors, friends, or for you and for yourselves, if you need services, this is a high quality place to come and we provide really high, we receive really high patient experience. So just a little bit about our history is that the health center movement was founded out of the war on poverty. At the time, there was no safety net. You had to pay for your healthcare. If you didn't, Medicaid did not exist. So health centers were created to be safety net providers. So our first location was on the Upper West Side. We were called Ryan Health, the name of Congressman William F. Ryan, who was the congressman from the Upper West Side. And he was able to secure money from the federal government to open the first center in the Ryan network. So we are 14 service locations from Washington Heights down to here, Lower East Side, and we're looking to grow. This is our mission. It's a lot of words. And so we have 8 minutes. So I'll say essentially it's high quality care is everyone's right and our responsibility. And also is that we are recognized that going with the vision and that it's just that we recognize that it's just not healthcare that gives people health. Talk about this to our team members when they start is that while people need high quality healthcare, they also need, this committee was charged with that, is how adequate and safe housing. Other probably communities work on access to good education, access to good and safe housing, it's clean, because you can get a prescription from the doctor, and if you go back and you have rodents or other issues in your home, that's not gonna help you or your children's or your elders' asthma. So we need to work together as a community network to take care. So as a community health center, we take everybody who walks through our doors, regardless of their ability to pay. If people do not have insurance, we work with them to get insurance, whatever they qualify for. However, if they don't qualify for any insurance, we put people on a sliding fee scale. Slides down to about $35 a visit. People don't even have $35, if that's happens in our city and country, unfortunately, is we don't turn anybody away. We'll say, no, next time. But, sometimes people just have very limited use. Do you want to talk about it?
Yeah, so federally qualified health centers, they've been around for a long time. They really started during the civil rights movement. They've had different names throughout the years, but basically what it was about was what Dan mentioned, that they were built upon making sure that people who needed healthcare were also getting other services, that it was really around the war on poverty. So this kind of slide just gives some of the different the timeframes of what health centers were called over the years. They've changed dramatically now. Federally qualified health centers is the term that's used. There's 14,000 nationwide. They serve about 32 million people throughout the nation. So we are really like the largest primary care service provider nationwide. And we accept patients, as Dan mentioned, regardless of the ability to pay. So that's why we are considered a safety net. So whether you're insured, underinsured, Medicaid, private insurance, we accept everyone. We see 52,000 patients across our network a year. That equals out about to over 200,000 visits a year. Most of our patients are low income, so we have 88% of our patients are low income. 70% of our patients are enrolled in Medicare or Medicare, and 8% of our patients are uninsured. We serve about 75% of our patients are people of color, and we served over 9,000 New Yorkers or asylum-seeking families throughout New York.
So we have 7 primary care centers. We have 3 school-based health centers. One is a few blocks from here, forgetting the name.
PS 188.
PAS 188. And we have also a emotional wellness center, which provides mental health. And once you get your license, you can come and apply for behavioral health providers. So in Community Board 3, we have the location here, PS 188, the Island School, and we have the mobile health center. So we also look at to match the services that we're providing at the centers with needs assessments that are conducted by the city Department of Health. So these are some of the areas that the city has identified for. It's not exactly Community Board 3, but it's from the Lower East Side, the zip codes. So mental health services for the uninsured, care for refugees, and social drivers of health, such as food insecurity. So we do have a mental health clinic here that has psychiatrists. Let's see. How many social workers do we have here? Three social workers. So, and we're looking for more. But so this is a little bit about the history of it. So Nina celebrated 55th anniversary. Actually, Congressmember Baldwin was here recently. We gave him a tour. Senator Kavanaugh was here recently. Assembly member Epstein, who will become council member Epstein, I think, has been here. Actually, so what people don't know is that the first nurse practitioner program actually started right here, because there was a shortage of providers that would come to the Lower East Side at that time. So there was doctors and there's our registered nurses, and registered nurses that they were interested in learning more about medical training. So they worked with Columbia's School of Medicine at the time. And so we don't celebrate it enough, but actually the nurse practitioner program was started right here on the Lower East Side. The organization that was operating Nina in 1988 was having financial issues. And so the state asked Ryan Health to oversee it, and we formally merged. Last year, we saw 11,000 new patients for 43,000 visits at this. And so we also participate in flu shots, the Lower East Side Festival, the free mammogram screenings. And then I let the doctor talk about the next.
So I'm Dr. Lynch. I'm a family doctor by trade. I am the chief medical officer. I've been practicing with Ryan Health for 11 years now. I've been in multiple positions at Ryan Health. I started as a full-time practitioner, full-time physician, and then most recently became chief medical officer. We offer really high quality care, and we offer a lot of services, which I'll go through, but the most important thing to us at Ryan Health is really ensuring that our patients receive respectable, dignified care in addition to quality care. It's really important that our patients, when they come through the door, that they feel welcome, that they feel that we are gonna be a trusting medical provider, that we're gonna be their medical home, and that we're gonna be able to help them with other services, as Dan mentioned, outside of just prescribing medication. Because as we all know, that doesn't fix problems. We have to address a person's problem. If I have a patient that's living in transitional housing, I can't say to them, cook meals, healthy meals every day, right? That's not gonna be really advice that they are able to follow and may be able to help them move forward. It's only going to put a barrier in place if I give them advice that really doesn't help them in their situation that they currently have. So some of the offerings that we have, we see primary care, so adults, adolescents, pediatrics. We do have women's health, both here and at other of our locations. We provide prenatal care, both here and other sites. We do HIV primary care as well. We have a large number of patients that are living with HIV, and we want to make sure that we are caring for all of their medical needs. We do adult pediatric vaccines, we do STI testing, PrEP and PEP, which is prevention of HIV, and also post-exposure to make sure people have prophylaxis against HIV exposure. We do breast, chest feeding support, so we have a lactation specialist. We do gender affirming care, we have cancer screening programs, and we also have a healthy weight management program within our network. So these are the services that are throughout our network, including some specialties. So dental, we also have dental here at Nina, but also at other sites. Eye, nutrition, gastroenterology, we have geriatric services. We also provide case management and radiology as well. Some of the mental health that Dan had mentioned, we have social workers that provide psychotherapy. We have psychiatrists and nurse practitioners that provide medication management for our patients that need medication prescribed. We do depression screening with all of our primary care visits. So we screen patients for depression, looking to see if maybe someone doesn't feel that they have depression, but some of the symptoms that are associated with depression they may have. So they may not even realize that, you know, their lack of feeling enthusiasm for something that used to make them happy is a sign of depression. So we screen by asking questions that are not like, are you depressed? It's like, are you having any trouble sleeping? Are you having any trouble, you know, with your appetite? Things that people may not relate to depression. So we do depression screenings for all of our patients, and we provide group therapy, individual therapy, and like I said, medication management. We also provide addiction services. So we screen, we do universal screening again, just because we want to ensure that we are not missing patients that might be coming for a flu shot, but may have some other needs that we may want to address and let them know that we're here for them. So we do universal screening, and we provide MAP, which is a medication assistance program for, people who have opioid use disorder. So as we know, there are a lot of patients that are finding themselves addicted to either pain meds and then becoming addicted to other street drugs. They are needing some assistance with opioid use disorder. So we prescribe Suboxone, buprenorphine, which really helps people, and we integrate that into primary care. We don't want to stigmatize. We see patients, my first patient may be addiction services, my next patient may be blood pressure, diabetes. We don't, we incorporate it into our primary care services. We also do tobacco cessation, and we have support groups for that as well. We also address patients based on their needs. So we call that like the pop health model. And basically what that says is not every person, one size fits all, right? We have to be able to address a person's issues based on some of the conditions that they have. We talk about food insecurity or housing insecurity. We talk about education level, literacy. We want to make sure that we are addressing a person's needs and providing them with care that is specific to them. And then these are just some of the quality care things that we have. We're Joint Commission accredited. We are a patient-centered medical home. We have been recognized as a patient-centered medical home through the national NCQA, which is the National
Center for Quality Assurance.
Yeah. National Center for Quality Assurance. I have to remember all the acronyms. We've been given Health First Awards. We partner with Mount Sinai, and we've been seen as best partners with them. So these are just some of the accolades that we've received.
Yeah, and just, I mean, on the product side, we joke that I can come here and Dr. Lynch can say, we're the best, we're great. It's always nice when an outside organization like Health First or Mount Sinai, or some of the other actions that they've taken in the neighborhood said that we're the best community partner they're looking. So that's, we appreciate it. We're also an advocacy organization. So Dr. Lynch and I sometimes go to Washington and Albany, particularly what's going on recently with some of the reductions that have been proposed or enacted. Some of the communities that are being looked upon and services are being restricted, in particular in those communities. So we go and we talk to our elected officials and say how that we see what's happening in the communities and on the ground. That those, particularly as a doctor, can talk very intimately about what she sees that's happening to our patients. And for elected officials, sometimes there's a lot of lobbyists, but to actually hear from a physician who's hearing from her patients what they're experiencing is very, very impactful. So these are some of our key partners. Henry Street Settlement is on the Lower East Side. We've just developed a much stronger relationship with Grand Street Settlement, Educational Alliance. I'm trying to pick out the ones I know that are down here. God's Love We Deliver is everywhere. But we work with many, many organizations. And as I said in my opening, is that people's health is also connected to a community's wellness and their own wellness. And if we don't all work together, then we're not providing the biggest impact that our neighbors and our families might need. So it's like the fastest way of working. So we are also always looking for board members. So community health centers are by law, by any statute, are required to have greater than 50% of its board members be patients. So that's unlike many other places where they're looking for super wealthy people. We won't turn away super wealthy people to help them do fundraising. But it also means that patients who are my boss are impacting and telling us like how well are we doing in terms of reaching the community, how well are the services that we're doing. Last night we had a board meeting and one of our community board members was saying that he loves his doctor and he doesn't mind waiting, but we don't tell him quick enough, like it's 20-minute wait or 30 minutes. And that's something that we can improve upon. So it's good to hear that comes back to the CEO and the CMO and the chief operating officer so that we can impact that and figure out how to make that work.
Right.
Um,
So it's important that we also have patients sitting at the table when we are making decisions about, what's gonna work for the organization or what's not gonna work. So that's really important to have 50% of our board members be actual.
Oh, it's
No.
board of directors.
Board of directors.
So the governance
Yes.
of the organization.
Yeah.
So yeah, my
Yeah.
boss.
Yeah.
My boss.
Yeah.
So that's our, I would also just want to say again, thank you for having your meeting here. That's part of our goal. Dr. Lynch and I are not new to the organization, but new to the roles. And Ryan used to be fully or much more integrated into many of the neighborhoods. And then some of the organizations floated away from that, but we're bringing it back. Because if the community and individuals aren't well, then we're not doing our job. So it was intended during the house and during the time. We'll take questions or discussion.
Okay, so, if you have a question, raise your hand, I will call upon you. I'll call on committee members first, Ronnie, if you have a question.
Yes. So I know that most of your patients are uninsured, but do you also take patients who are privately insured as well?
Most of our patients are insured. They are, insured with Medicaid, but we also take all types of insurance. We take private insurance, Medicare. But a small majority are uninsured, but most of our patients do.
And what's the waiting list look like for new patients?
We're able to get patients in really quickly and fast. We have same day availability at almost every site. So I don't think that would be.
Mariel?
No.
For those of you who live in the neighborhood and who have not been to Nina in the past. So yes, we have availability within a couple of days, so if you wanted to.
I have loads of questions.
Okay.
Let everybody else go first.
Okay, all right.
And I do.
You mentioned the high need of social workers, what is their like?
The social work?
Yes.
So we have different ways that we provide psychotherapy. We have something called behavioral health integration, which is where we have social workers embedded into our primary care space. So they work one-to-one with the primary care provider. So if someone has depression or anxiety, something situational happening, and they may need some short-term therapy, maybe an antidepressant, they would be seen by our behavioral health integration. And our behavioral health integration social workers work Monday through Friday, 9 to 5, or I think we have like one evening a week, and they basically work closely with the primary care provider. Then we also have an Article 31, which is another level of mental health providers, meaning patients have a little bit more of a severe mental illness and are not managed by a primary care provider. They're managed more by a psychiatrist or a nurse practitioner, that's a psychiatric nurse practitioner. And those social workers work closely with the psychiatrist. They do the same thing. They do psychotherapy. It's usually on longer term. And they work closely with the psychiatrist. And it's the same type of thing where they do a Monday through Friday, providing some late night services. We try to provide late night services or evening services because that's what the community and patients need because of work, childcare, different things. So,
I'll also add is just, and we do provide some telehealth services for counseling.
Okay, sorry, I'm late, but have you said, one question, and this, have you seen any decline based on, undocumented, patients, and if so, is it a large decline, and what are you trying to do in order to service those that are afraid to come?
so we had seen a large decline, not large, but we did see a decline. We noticed a decrease in visits. We have one site that sees more of our New Yorkers than some of our other sites, only because they are closer to some of the family shelters. So they are close to Port Authority. So we have a large number of patients that are seen at that location. That location did notice that when we had ICE in the communities, going to different parts of schools and running throughout the city, we did see that there was a decline in business. So what we did is we increased our telehealth opportunity because people were afraid to come out of their home. And we were providing services for patients through telehealth as opposed to having, so we were converting in-person visits to telehealth. And just letting people know that we were there for them. We do not check, we don't track, citizenship or anything like that, so.
And the other thing is that I work with Educational Alliance, we're at CRW. So all of our new intakes come and have their physical and get assigned with PCP. And it's been a really good, working, relationship. So thank you about that.
Oh.
And then I don't know, I'm assuming, Susan shared her experience. I also, this is my clinic from birth to 6.
Oh, wow.
Back in 1911.
In the 1900s. In the 1900s.
And it was such a wonderful experience. The only reason why I left at 6 is because my doctor left, Dr. Ackerman. I still remember her to this day. And
Wow.
that's the only reason why I decided, my mother, because I just didn't want to see
And that's that.
anyone else.
Right.
And coming back in the fold, I was like, who the hell is Ryan? Because I've always known as Nina. So it's nice to hear that you're calling it Nina as your, because that's what I'm assuming. It felt really nice. Although I know it's Ryan Nina, to see here that you pay homage to the clinic that I.
Yeah.
so loved here.
Oh, wow, that's amazing story.
We should have videoed that.
But yeah, we have a lot of patients who have been with the organization for a long time and multiple, at the different sites that remember when we first opened. So it's really nice to hear that, you know, we were part of the community, and it's really important that we get ourselves back out there and known as, yes, no more just Nina, now we're just Ryan Nina, but it's the same place, the same feel, the same welcoming environment. And knowing that the patients have complete.
And prior to Nina, Nina stands for Northeast. Nina, so Nina definitely don't happen for
So earlier in the year at community board, we had a topic of agenda called the social care network, which I'm just curious to know about the Ryan Health Network, how that whole process has been or experienced, actively involved in it. And that's a great way to connect all the network and the community partners. So just wanted to check in with you on that.
So the Social Care Network for Manhattan is overseen by Public Health Solutions. They're probably spoke. So we are part of the Social Care Network. We do screenings that standardized by the state, what we call PHS. And then when people are screened, we send it into a portal. It looks like portals, and then we refer people, and hopefully not all the time, but we get reports back to the primary care providers about what the outcomes of show up, whatever service they need. So we are a part of it. Social Care Network was part of a special plan that was approved by the last president. And this current president just going to end that in a year or two, so unfortunately. So the idea when we talk about is community wellness was to try to bring all of the pantry, community health center, shelter together and be able to be more coordinated. That was the goal. So we moved in that way. Unfortunately, it looks like this administration's gonna.
Good evening. I know that I've had a long relationship with Ryan, both the Ryan centers. But one is, I used to work out of the
Ryan Center, 97th Street. And so, dealing with Barbara and all those people out there.
Yeah, yes.
So
We
that,
got way back.
oh,
Like that far.
again. the
Nice
night-
to
Well, actually, the early 2000s, right? But, you know, you know, my main focus now is the geriatric center, and I remember dealing with geriatrics rather, by then dealing with aging parents, and so I remember talking to Barbara and saying, listen, can we have a doctor that just focuses on older adults?
Mhm.
And so then they did. And so both my parents were, then I just enrolled them right in there. And it was great in that sense, and I'm glad to see that that's now instituted in all of the Ryans, because, many of my clients, I run a NORC. So that if you all want to talk to all of us, we can certainly make that happen. Where a good many of my clients come here. And so, you know, they tell me all about, you know, the doctor that they had and the medications that they're taking, and that they really listen to what their needs are, and so that's just very important. But I do remember those early talks, that was just, hey, wait, we have pediatrics for the babies, we gotta take care of our older babies.
Yeah,
And so, make sure that that happens.
so we do have a geriatrician, we still have a geriatrician in the network. Our geriatrician does rotate through Nina. So she's here, I don't know what day, but yeah, so we have a geriatrician here, 65 plus. And she works at other sites throughout the network.
Exactly. And this area is definitely an aging population.
Well, we have one right now, but if we definitely see the need to expand, we have a lot of availability for our geriatrician here. We've been doing a lot of marketing to try to get our geriatrician even more busy, because there is a lot of availability. So if you say the community needs it, we have it, and we have access and availability.
And we could come to the North and do a presentation, you know,
That would be great.
Yeah.
And yeah, I'll definitely introduce you to the Greater Norks. He's a brother Nork. So, you know, we all meet at least quarterly. So we can certainly have the general introduction to all of us. And then, of course, depending on any kind of topic, certainly come and meet our seniors.
That'd be great.
I just have one, because I didn't know about this one, I'm born and raised in North South, but I didn't know about this location. I've gotten my, I would have got fibroids in the line up on 90 something street.
And so-
And that's the one that I know about. So when I saw this, and everyone's talking about this being here's a little bit like, because I know more about Kansas.
Yes.
My mom was a social worker at, Jewish Head Start, so they're more acclimated there. So I think I'm really glad that this is coming to fruition with the neighborhoods and stuff like that. I guess my one question is, how is your, the population for the teenagers and their, physical and mental health? How is that population when it comes to them making sure that they're taking care of themselves? For a person who does mental health for middle school, they think that they're invincible, they don't think that they need that, even though they're minors, but when it comes to high school and young adults that are college age, there's usually always after the fact that they need help instead of doing, health prevention.
Yeah.
Which is more, trying to get them to understand. You do get help afterwards, but like, how is your, retention with that kind of population?
So we do have a pediatrician here as well that sees patients, they're credentialed to see patients until 21. And we also have mental health providers here. We also have the school-based health center, which sees younger, students, but we are definitely here to provide services, that's needed or necessary. Yes, our 96th Street location is most of what people know because that was the first one, the largest one.
That's where Barbara sat.
That's the largest, yeah. We also have the OBGYN, We have the Women's and Children, where we have pediatrics and women's health on 801 Amsterdam, which is around the corner from 96th Street. So yeah, so those are the two larger, but they're not our only sites. We have sites in Harlem. We're looking to expand into more sites in Harlem. We have Midtown. So we are spread throughout, but yes, we do provide services for our pediatrics. We actually have a newly hired pediatrician within the last year or so that's really been welcomed and has really been accepted into the family here from the Lower East Side.
I'd also just add is that during the summer, the Harlem Boys and Girls Club approached us about doing a health education and promotions and wellness program. So I think they did it at 2 locations, one for the younger cohort to make sure it's age appropriate, one for an older cohort. We covered health, specifically health things, but also about safety in relationships or conversation on social media, internet. Was really well attended. I think there's over 180 kids that were serviced over the summer. Older kids, I think, was part of the summer youth program, but the younger kids was part of the club. So we would be willing to come anywhere.
Yeah, okay. Okay, so I'm so sorry to apologize before I speak. Piggybacking off of, her, I love that we're discussing this. I noticed, because I'm also I used to be on the Community Education Council, which is like the school board in the district. One of the things that a lot of our parents are in need of is having assessments done. It is so hard to have either free or affordable assessments done for your children. And it's maybe a year or so wait, and that takes a lot of crucial time in the educational process as your child is trying to acclimate and learn. It's hard. Like I know University Settlement has one psychiatrist that handles assessments. So if you miss an appointment, you're back on the wait list. That may be another 5 to 6 months. And especially after COVID, there's a lot of children that have diagnoses that were not addressed. And so I'm sure there's a backlog within all the schools and trying to find a place that our children can have their issues addressed. Is that anything that you guys would think about looking into? 'Cause I can tell you now, if you went to, like, we have school dates, if you introduce that to any school, especially in our district, we have transitional housing right here in a shelter. If you introduce that, I'm positive there'll be a wait list, even if you work for University Settlement and even addressing their wait list, you will get a large population of folks. And that may be a way to get back into for the community to get to know you.
Yeah, so one of the things with child psychiatry, just in general, there's an increased demand for it, but there's not a large supply of them to do the assessment. So it's really not only about the access to like getting appointments, it's even having the providers and staff to do the appointment. So we do not have a child psychiatrist on staff, but definitely would welcome having one. But the demand is just so high for them that is not, we do not do evaluation.
My son has an IEP and we were on the list for a while, and then after a while, we just went paid out of pocket, which is terrible, but we
Yeah.
spend that money, but to get the services he needs, it's exactly what you said. Like we would call and they would say, oh, you're coming up, but it didn't sound like that we were coming up on the list. But so that's something that we're actively looking for child psychiatrists. It's just so difficult, especially in our city. A lot of people who are psychiatrists can get cash because people with money
Yeah.
pay cash. They can command a lot of money. So to do community work, it's not necessarily always the focus.
I look personally, and this sliding scale was $1,500. Is that scale in Sligo?
So you're saying that they can financially do better on their own than working for. Oh, than working for a.
Or a nonprofit, yeah. Yeah, or working for a for-profit.
Anyone, because they're paid so
Right.
Okay, Susan.
First of all, thank you. It makes me feel so good to see what you're doing. So I really Appreciate it. I'm gonna start with New Americans. So we have, as you're aware, I'm sure, some incredible community groups and for instance, EV loves NYC that, you know, they cook food and serve free meals to a lot of people. And I know, like right now, they're working, we have a lot of, men from West Africa who are app delivery workers. They're all like on around 11th Street. But they get a lot of the meals. I'm wondering if there's a way to outreach to some of these people. And also they speak various languages. You know, it's, African dialects, French, Arabic. So I'm wondering about language. Walla, absolutely. So I'm wondering one about language, and is it possible to do some kind of outreach, even maybe where they, you know, get meals? So that they would know to come here?
We actually do a lot of outreach with some organizations that have been founded and built by, West African, community members. So I'm blanking on the name. Clinical, yeah. So what they do is they do screening. They do, blood pressure screenings, diabetes screenings, prostate screening, but they did not have a place to send people for primary care after the screening. So it's really, you know, it's really important that you create a partnership with another community-based organization that is mission aligned with you. Because if after you build trust within a community, and you are referring them to someone else, you want to make sure that whoever you refer them to takes care of them and treats them the same way that you do or have. Because if you don't, that trust will be broken within seconds. So we have been partnering with them because they were actually referred to us by Department of Health to say, hey, this is a partner organization. So we have been partnering with them to provide primary care. So we table with them. So when they have screenings, we're there to then set people up for primary care appointments. And then we also do in Harlem. What was the
We work with mosques.
Yeah, we work-
The state senator, Senator Clear from Harlem, has connections with many of the mosques there. So we've done health education, outreach, screenings.
Hope Drive? Yeah. We've done a lot of things.
Do you ever do, like Bellevue does, they have that street team, a mobile team, but they're in Cyrodiil and Roosevelt Park, but we couldn't get them in Tompkins Square Park because they just don't have the resources. Do you ever do anything mobile like that?
So we do have a mobile health unit and we have 2 smaller prevention vans. So we have a mobile health unit and we go to soup pantries, I guess. They just call them soup kitchens. But and so then to Dr. Lynch's point is that sometimes that the pantry workers or the pantry team members have created relationships with people, or there's that trust between somebody who might be street homeless or in a shelter. And so once they get to know us, and then they can go to that individual and say, they'll treat you right, they'll take care of you. And that is like an entree or way, since they trust somebody and that trusting person says, they're gonna take good care of you. So, and we can get from Marielle's if there's some in the neighborhood, there's places that you think that we should be able to take our mobile health unit and we'd be able to provide services and even bring care, that would be terrific.
So, you know, one of the most frustrating things in New York is the fact that there's not overall coordination. And like, I'm thinking we have a number of federally qualified health centers. Is there any network? Do you all know each other? Yeah.
So we belong to a state association called the Community Health Center Association of New York State. And we have calls, I meet with the clinical committee, Dan meets with the policy and the CEOs and administration. We have different webinars together. We do an annual, we come together for an annual conference. So yes, the community health centers across New York State do have an organization or association that we belong to. So we say,
Like Yvette, who's the new CEO of Betances, and you see Julia Dan. I know her, but actually she's weird.
I was just actually introduced to her to come to the community first.
Oh, okay. So, yeah, so I text her like, because there's so much going on, particularly now in the environment. We have to lean on each other for both support and also like, how are we going as a group? Yeah, as a group, to defend communities, but protect communities who are really at risk at this time.
I'm gonna say one of the needs in our community is people who aren't coming into you, who are homeless, on the street. They're in the parks, they're in the Tompkins Square, they're in the Mosquito Park. People, like some of these, app workers who may have been someplace, but they're not seen, they're not going in any place. And, I really think there has to be, some kind of field or street, you know, like a mobile place, or even, like we now have, been help facilitate harm reduction workers going out with homeless outreach. And I think partnerships like that are often really, really good. And I think that's an incredible need. And like say, people that are not coming in, or at least not until they may need, you know, to see somebody at a homeless site, and maybe they'll follow up, I don't know. I've also found out with working with harm reduction around here, that there's no tracking, there's no statistics from any of the organizations. I guess because Department of Health was require it, like when there is outreach, how successful, what, you know, what is the follow through? How many people, end up, you know, having at least some sustained help? So those are just needs that I see. I talk to the, homeless outreach a lot, they feel that the safe injection site is something. So be interested in knowing how you, feel about that, your thoughts about that. One of the things that we would be interested in knowing, because we vote on budget priorities for our communities every year, is where you're struggling with, particularly with city budget or money that comes through city budget, that, where you're struggling, what your needs are the most, where we can help advocate.
So I'll start. I would say
That was a lot, right?
So in terms of budget priorities, I would say at least one of the top three is behavioral health services for children, young adults, and that's inside around stable. Is that it is not necessarily easy to find social workers with that interest or experience. So more funding for that would be very, very helpful. List of them.
The assessment, is that also part of that? We were talking about with the
child
the assessment.
psychiatry.
Is that also?
Specialty in children, I think that's where the needs come, but people, me going through my program, I think I was the only one that could cater to children, because they don't have the temperament for it, but they also don't want to deal with the parent, because they're minors. Like anyone that's 18 and older, they don't mind children, but I think it's more about dealing with children is different than dealing with adults. So I think that's because of COVID, we have a shortage of people wanting to be in pediatrics, in psychiatry, and social work, in mental health. And I think the temperament of being with elementary, middle school, and young adults is like kind of hard, because people just don't, they don't like children in that type of way. But also you feel, kids are really going through a lot, and I think finding a way to figure that out, that would be great, because it's not enough people for the amount of it's really a lot.
Even before the pandemic, there was a huge demand, and since the pandemic for children, even for adults.
I just want to see the participants.
But that's definitely a budget priority.
That was, yeah, so I don't.
Thank you.
Oh,
I have one more question.
I was just thinking of another budget priority.
We're not used to
Oh,
ask
actually,
for-
there is another,
We're not used to ask for like, what do you want more money for?
well, no, there is another budget priority on the city level, and that's for school-based health
Oh,
centers.
that's right.
So our school over here at PS 188 doesn't receive any city funding. We get a small amount of money from the state, and we have been advocating for the past several years for funding for school-based health centers across the city, including ours. And so that would be something that as we come into the budget season, we'd love some advocacy and support for.
I think this is going to be my next question. So you're associated with Beth Israel. I'm not signing Beth, Israel, I forgot. I used to be Beth Israel, 1900s. They were Beth Israel, so it's MSBI now. So if, say you have a I'm trying to figure out the assessment, say you have a doctor at, their ambulatory center, and they want you to see a gastro, and whatever. They could, I mean, you could have a doctor there, but be referred to a doctor here. Are you, like, when you go on the portal for them, are you on the same portal?
We are not on the same EMR as the,
It's
at the
medical.
hospital.
Yeah.
Medical record. And we don't have much specialty access. Hospitals have a lot more than us, so we have a small amount, and we don't have enough probably for our own primary care, patients. So our specialty services are usually for our primary care patients. We don't usually promote specialty for outside primary care patients because we don't have a lot of it. It's really difficult to employ a gastroenterologist because they're very expensive specialists. So we're not able to have a full-time gastroenterologist. We just have a part-time gastroenterologist.
What if someone wanted to come here for blood tests or something like that?
So they would have to see a primary care doctor because again, someone would have to monitor that blood test results when they come in. If there's something wrong with them, they would have had to see someone who can call them and follow up. So we're not like a blood draw center, but we do have Quest, and we're able to do blood tests on site.
I was trying to see if you could sort of mix and match. It doesn't sound like you're mixing and matching.
We have access into if the patient gives us access, we can go into Epic, which is what Mount Sinai uses through their system. So we have some training locations where they provide their residents and they provide the primary care or some primary care. So that's we're two separate organizations that work together rather than fully.
Very convenient, you know, in Mount Sinai and NYU and Memorial, they're all on the same thing now, so you just get on and everybody can see everybody. It's very convenient.
So I'll say Epic, which is the name of that system, is incredibly expensive.
Yeah.
So that's why all the large academic medical centers are,
Well,
there's only one health center that's associated with, Sinai.
we have like 2 or 3 hospitals that are taking over the work. We know that. We know that.
Denise, is there anyone?
No, okay. Yeah, first of all, thank you. I was at a policy briefing panel this morning, on this severe mental illness at the New York Law School, and I feel like it's not that I've learned more here, but it's just perspective is so much more of what is not need to be there, and they were very good, but anyway, thank you for that. So I run a park coalition, or it comes to me really, but, I have noticed an uptick in, teenagers. Well, this last weekend saw somebody in the middle of the playground, filled up sleeping, brilliant, safe place to be, but little kids running, you know, all around, and periodically I see that, and I'm just trying to find, and it might be other people here, is there anyone who that specializes or you know, they're young and they're really in trouble and, you know, they're excited, you know, who are they gonna talk to? So I'm just curious if you know anyone I can say, turn to.
The door is also, is a community health center, and we also have other services that target. Have expertise in community.
I have two really good youth officers at this precinct, I believe, you know, maybe in my next spot, but
I mean,
yeah.
if they identify as LGBTQ, coming forward. Such a outreach to teens. Very, very.
You know, the slideshow, did you send it to the office? That
I don't
slideshow?
have that.
We can send it, yes, I can send that to you in the morning.
Yes, that's our final question, Eric.
One question. On the lower east side, we have 11,000 patients in this past year, you've seen?
Or last year we saw 11,000.
Correct. Is that all representative of this neighborhood, or it's kind of the city?
It's mostly this neighborhood. I would say it's because of the proximity to Brooklyn. You get patients that come from Brooklyn because people tend to follow the lines. But most of the patients come from.
More than 30%.
Oh, yeah. And that's what's, part of the core mission of the community health center is to be serving people who live. So I know it's the last question, so, in closing, we want to thank you again for using Nina or Nina. Feel free to use every month. To hope you want to, as I said, be part of the neighborhood and the community. And for people who either work at Norwich or other organizations, will get your information and reach out to you about coming out to do more presentation.
Yeah, help you next Saturday.
We have a health fair next Saturday, so thank you for that. Shout out as well. Anyway, we just want to really thank you all for everything you do. Oh, that's what I was gonna say, is if you know people who are on Medicaid and are unhappy with their services wherever they're going, or if you know people who lose their insurance, and in the next 2 years, the way things look, unless something changes, you know, New York State's about 5% uninsured. The governor's office is projecting it's gonna go up to 21% at the end of this. So what's gonna happen? So if you know people lose insurance, or that they get Medicaid, or if they lose their job and have commercial insurance, I mean, they'll take commercial insurance, but they'll take, you know, please let them know that Ryan, Nina, or Nina is here, and we have we have dental, you know. Like now, family care, so we can see their kids, we can see if they're older, you know. We are, they have to, like, communities. Thank you.
Thank you very much.
Thank you.
All right, so I don't see anyone from the school on,
Oh, you mean, Harry, they're not on it.
there's nobody on, you can see who's on. Yeah. Daryl is on for, human rights.
Okay, is Carrie or no one from, Carrie or Christine are not here?
No.
So if none of them are here, then we'll,
You want one of these?
Was
Is Daryl promoted? Did he ever get promoted?
I'll take it.
Yeah, we just have to spec for allowing. No, we want to make him a co-host. I think you did that. Then you shouldn't have to.
okay, thank you very much.
No, he's not promoted at all. So Daryl, you have to accept the promotion. Oh, now he's getting. Okay.
So just, you guys have to talk. Microphone is here, so just.
Hi,
Wow.
you can see and hear me okay?
Yes, Deborah, I hear you. Okay, everyone, sit down, we're on to our, thank you. Okay. We are, our next agenda agenda item will be the New York City Commission on Human Rights. We have Daryl Cochran.
Cochran, yes. Mhm.
That, Daryl. Okay, so, all right, are you giving us a presentation or a slideshow or?
Yes, yes, I am. I'm gonna share.
Yeah, you're a co-host, so you can share. screen.
Okay, so you give your presentation, it's about 8 minutes. After that, we'll take questions and answers. I will call on them, and then, they will, so all questions and answers are after your presentation. Presentation first, Q&A last.
Okay, that sounds good. Let me see if I'm
So you can, you can go ahead and share your screen and start talking.
okay, great. Thank you. Sorry, I'm just having, oh wait, is that it? Oh, this might be it. Okay. Can you see my screen?
Yes.
Okay, great. Thank you so much for having me here. Welcome back from the summer break. I know how that feels. I'm also on Community Board 12 in another hat that I wear all the way uptown. So I'm just really going to go over who we are as the Commission on Human Rights, talk a little bit about the protected classes and the human rights law, and then we can talk. I know there were some questions I got via email, and we can go over that. But if you're unfamiliar with us, we are a relatively small city agency. This is nearly all of us. A couple of years ago, we're about 110, 115 staff. And our central office is located at 22 Reed Street, so just a block north of Chambers. And that's where we do walk-ins as well, particularly for folks who live in Manhattan. But the human rights law functions in these 5 main areas. I think most folks are probably familiar with 2 of them in particular, employment and housing. So that is if an employer or prospective employer or a housing provider or prospective housing provider discriminates
Oh,
against.
Daryl, 1
Yeah,
minute.
he's not sharing. He needs to go to
The next slide.
slideshow.
Yeah, slideshow.
Yeah,
Yeah, you need to go to the slideshow.
Yeah, we're
It's
only-
not showing.
yeah.
Oh, is it not forwarding?
No,
Oh, that's
All
odd.
it says is square that says New York City Commission on Human Rights.
There we go.
Oh, okay. Can you see that now? And
Yeah.
Right there.
Well,
there,
he
you
needs
need
to
to go to-
share it though.
Oh,
yeah. Go to slideshow and then present. The slideshow button.
Yeah, it's on the upper right.
In between animation and report.
mm,
And then go to present.
if I,
In the ribbon, upper right.
Yeah, like the home, there's a home button.
It should
And
be-
over, like, over
it's
there, will say
orange.
slideshow.
The thing is, your button is orange and share.
yeah, it says I'm sharing.
No, present in,
Slideshow.
yeah.
So you need to go to slideshow
On the PowerPoint.
at the top. It says see where it says.
Not that.
And then go over to the right and then slideshow.
Over more.
Can you see us? No, here.
I cannot see you now.
Oh, okay.
Oh, but is it on here?
Yeah.
I don't know if you'll be able to see it.
Yeah. If you go down
Is
to
it
file.
This one?
No.
No,
Right.
go down to file, then go over to home, then insert, there you go.
Okay,
Go,
you go left to
keep
five.
going,
Oh.
keep going, keep going, keep going,
Keep going.
Okay. Slideshow. All right. Now you can see that?
Hey, go to the left
From
from
beginning,
beginning, underneath home.
Go back to home.
okay, go up,
Go up,
go up,
go up, up. No, no.
Is it doing it?
No.
Now you have to go to home.
That is fine.
where is it, present and, no. Customize. You should have it, but you have it. Okay, we're just.
Is that it?
I don't know. If I do that, can you see a different slide?
Yeah,
Yes.
I can't hear. If someone could,
What should he be doing?
Yeah.
Yeah, it's on the right side, right?
Where is orange?
Okay, it should be slideshow from beginning.
You did that already.
You did that from beginning?
yeah, I did that.
But there's a
Okay.
presenting on the upper left, on the upper right.
So to me, it's in presentation mode at like the big screen. Yeah.
If you go from current slide, try that one.
From current slide.
You could also press the little button that looks like a screen at the very top of your PowerPoint presentation, next to an orange PowerPoint button. All the way at the top. Bring your mouse.
Whoever's talking, it's muffled. Sorry, I can't.
Oh, bring your mouse higher.
Say that again.
Bring your mouse higher to the very top of the screen. Yeah, right
Is
there.
this it?
You just want to try that too. That might work. Okay.
Yeah.
It's just not.
Do you see the first slide?
It's not working.
No, it's not, what is city human rights law?
Right. If I forward it, do you see the picture of all the people?
No, no.
Huh.
It's on the side, but it's not showing. It's on slide 3.
You may be the one.
Yeah. Within where it says employment.
We have one other.
You could also try a second. Do you see the presentation mode on your screen?
Yes.
Do you?
Yeah. It's a full presentation on my screen.
Are you able to switch and share that screen on Zoom? So instead of sharing whatever you selected, so on Zoom settings.
Oh, I see what you're saying. Yeah. Let me. Okay. So I stopped sharing.
Yes.
Now I have to get back to. Sorry about that.
Yeah, when you click share on Zoom, are you able to see the screen that that's in presentation mode and select that?
Okay, hold on a sec. So, do you see it now?
And then can you click from beginning again?
Yeah.
Is that working? Is that a yes? I can't. Uh-oh.
Okay, we're good now.
We're good?
Yeah, we see a slide that it says, what is the city human rights laws? And it has like 5 colored squares.
Bunch of colors. Yes. Okay, got it. Okay, sorry about that.
No, I learned something.
So yeah, so like I mentioned, there's 2 main areas that a lot of folks know about: employment and housing. But there's also an area called public accommodations, and that is basically any business that's open to the public, restaurants, bodegas, clothing stores. It also includes taxi cabs and also includes city services. So any services that are provided by a city agency or provided by a community board, for instance, is considered a public accommodation. We also have 2 smaller provisions that we don't see as many complaints, but one is discriminatory harassment, and that is basically a civil form of hate crime. And for someone to file a complaint under that provision, it has to rise to the level where there's actually force or the threat of force being used in a situation. And it's also related to a protected class. So you might see that as someone maybe targeting a certain community or using certain slurs that indicate they're against a certain community as well. And then last but not least is bias-based profiling by law enforcement. And that's simply to say if NYPD discriminates against someone. We know that there's a separate agency known as the Civilian Complaint Review Board that deals with police misconduct. But if there's also something tinged with discrimination related to one of the protected classes, then we could take that complaint as well. It's important to note that in most cases, we basically have a 1-year statute of limitations. So you have to file a complaint within 12 months from the act of discrimination in which you're filing for. The one exception to that is gender-based harassment. So that has to be both related to gender, as well as have a harassment component to it. But if it's beyond a year and less than 3 years for the other protected classes, then we still may be able to refer you to the state court system. You can see the next slide, right?
Yes.
Okay, good. So we to establish discrimination, there also has to be some sort of relationship in those first three categories that I mentioned. So either employee, employer, tenant, landlord, customer, place of public accommodation. And I won't go into all of these, but these are all of the protected classes in specifically employment. I've been with the agency 10 years now, hard to believe, but in that time, the human rights law has expanded about 15 or 16 times. So even though we've been around since the days of LaGuardia, it does continue to grow. And some of these newer ones that I've been around for instance, credit history. Employers cannot ask about any sort of debt someone may have. Also, arrest or conviction record. That was at the time that was known as the Fair Chance Act, or ban the box. So employers cannot ask about criminal background on a job ad, during an interview, but they can ask after a conditional job offer has been made. Some others, sexual orientation has been around since 1984, or I'm sorry, 1986. Gender identity has been around since 2002. And one of the other ones that, a few of the other ones that were recently added as well, sexual and reproductive health decisions. Employers cannot ask someone if they had an abortion or if they're, taking medication to prevent or treat a certain STI. So those type of questions are off limits for employers. Additionally, height and weight were added to the law recently. So that is, sometimes there are qualifications for a job that may say someone needs to be only of a certain height. For instance, like on an airplane, they're only so tall, right? So if someone's 7 feet tall, they're likely not going to fit on that plane. And that's fine. That's more of a qualification than anything else. And then there's also protections in housing. Pretty much all of these are the same, except a few that I want to point out. One is, we used to call it familial status, but that is the presence of children in the home. Sometimes there are landlords that once they find out someone wants to move in that has children, be they small children or big children, because they're going to be loud, they're going to tear up the place. That is unlawful. Another area is lawful source of income. And that's actually one of the biggest areas of complaints that we've seen in the last 10 years. And that is if someone uses a voucher to help pay the rent. That could be FEPS, SCREE, HACA, Section 8, the GI Bill, SSI, any sort of program that provides a voucher to help pay the rent. Folks cannot be discriminated against simply for that. And this is one of the areas also that folks may not need to file a formal complaint. They could just call us, let us know this is happening. And what I've seen happen is our law enforcement bureau can get creative. They can reach out to the landlord and they could place a hold on that apartment until the case is resolved. And that could take a matter of days or weeks. But I've also seen where someone calls us on Monday and we resolve it with the landlord and they're in the apartment by Friday. Those are rare instances, but that can happen, particularly with that provision, because we do have a unit dedicated to source of income discrimination. And a lot of the protected classes that you see, race, gender, age, have been around a long time and were really created to protect marginalized New Yorkers, to protect minorities. But there's also a provision in housing called lawful occupation. And this is where I'm going to ask you a question. Do you know what occupation landlords did not like renting to?
Lawyers.
You've heard this before. Was that Susan? I can't see people. Yes, lawyers. Because if there's a leaky faucet or a crack in the ceiling, lawyers are shooting off letters to landlords saying, you better fix this by tomorrow or I'm going to sue you, right? So yeah, that's one of the reasons it came about. But it also does include folks like cops, for instance, because some landlords don't like the presence of guns in a home, and those who are in law enforcement do carry guns. So it protects that. It protects people who are artists, who are performing artists, musicians, right? As long as they're within respectful decibel levels in their apartment, they have the right to live there like anybody else. We do get questions a lot about sex workers and drug dealers. Last I checked, those were not lawful occupations, so that they would not be considered protected under that provision. I also want to briefly mention about reasonable accommodations. This says specifically for people with disabilities, but there are 3 other provisions besides disability status who qualify for a reasonable accommodation, and that is pregnancy status, status as a victim of domestic violence, sexual violence, or stalking, as well as folks needing an accommodation based on their religion. So, for instance, if someone is a victim of domestic violence, one thing they could request in a workplace is maybe change their phone extension, or not allowing a certain person past security. Or maybe if it's a bigger employer, moving them to a different location altogether. And similarly in housing, maybe taking someone's name off the mailbox or the buzzer. So that could be an accommodation. Disability accommodations you're probably familiar with. Sometimes there's architectural or structural modifications, both either in a housing setting or in a business setting. So those are some areas. We also look at what is reasonable. We certainly know that there are folks that live in 6th-floor walk-ups and they ask for an elevator. Well, chances are that's not reasonable because 1, where are you going to put it? And 2, it's pretty expensive. But sometimes someone could get an accommodation, say they're on the 1st floor. We know that a lot of buildings may have steps that go into the building. So maybe the building itself isn't accessible, but allowing someone to go from the lobby side part of the floor to the 1st floor with a lift, that might be a reasonable accommodation. It also includes allowing service animals in apartments that may have a no pets policy, because service animals are not considered pets. That also includes allowing service animals in places like restaurants, as long as they behave. But when you're in public, someone could ask 2 questions of a service animal owner or caretaker. Is it a service animal, and what service does that animal provide? And in case you were unaware, there are 2 types of animals in New York State that can be service animals. One is dogs, that most people are familiar with, and the other are those miniature horses. So if you see one walking around the streets of the East Village or Lower East Side, please take a picture and let me know. I talked about discriminatory harassment. That also includes cyberbullying. So we see that particularly among school-aged youth. And then that also includes, sorry, go back. That also includes if folks are being harassed while trying to vote. That's included in that provision. And with all the provisions, we can assess fines up to $250,000 in the worst cases, but but we can also assess damages to, like, emotional damages or back pay in some instances, and that is for all the other provisions I've talked about. That is not the case for bias-based profiling by law enforcement. Folks cannot get monetary damages from the police department, but we can mandate training and change policies and work with the police commissioner on those type of things. Retaliation is also a separate and distinct complaint. We know sometimes that discrimination itself can be difficult to prove. But sometimes what also happens, like in an employer setting, maybe someone's fired because they brought a complaint either to us or to HR or to EEO internally, or someone is, changes, they're forced to change locations, or their pay is cut. Anything that might be considered retaliatory, that is a separate and distinct complaint. I just want to really wrap up there. I already mentioned, what we can do in terms of imposing civil penalties. I don't think these numbers have kept up with the rate of inflation over the last decade. And this is just a little bit about the process. I don't know if you can see that on the left. But, we look for, is there probable cause? Our attorneys will investigate the complaint. And if there's probable cause, then it may go through the Office of Administrative Trials and Hearings, my favorite acronym in city government, OATH. And if there's no probable cause, then the person complaining does have the right to appeal. And they would appeal to our commissioner, who is Annabelle Palma currently. And that is why there's very much a firewall between the Law Enforcement Bureau and the commissioner's office in case those cases were to come up. And that is it. That is all. I will say a few things more. Let me just stop sharing here and see if I can see you again. Yes. And, one of the things I just want to mention as well is our work with community boards. Certainly we see that in areas of bias incidents. So if maybe there's derogatory graffiti that happens, I've certainly worked with community boards that contact us. We'll contact the MTA. I know you all can do it yourselves as well, but we're happy to do that. I know Susan and I have worked with on sidewalk access issues, particularly if there are, outdoor dining areas that may be impeding on what we know is, I think it's about 3 feet or 36 inches that are needed for wheelchair access on a sidewalk. And we work with a variety of different institutions throughout districts, including libraries, rec centers, bids, council offices, senior centers, etc. And with that, I will definitely open up to questions.
All right, so, yeah, okay, I'm going to call on people and they're gonna ask a question, and then the microphone is over here, just so that you are aware. So
Do I have to go up there?
we will find out. Okay, so Johnny's gonna ask a question.
Hi, can you hear me?
Yes.
Okay, so my question is vouchers, because I know a lot of people that have vouchers and simply cannot find apartments because landlords won't take them. And so so I haven't called this number, because I just figured government agency, I'm sure you get these complaints a lot. So how are they actually addressed and taken care of?
Sure. So we do have a special source of income unit within our law enforcement bureau. So what someone can do is when they call us, they can say, that it is a source of income complaint. And then what can happen is that the landlord or that our attorneys will reach out to the landlord and discuss the situation and see if it is, legitimate. Also we have testers. Those, are people that kind of mimic situations. If we hear this is happening on more than one occasion, and we could, maybe send a couple to look for an apartment that doesn't have a voucher and send somebody else that does have a voucher and see how they are treated differently to see discrimination firsthand. But
Take?
say that again.
How long would that process take if someone were to contact?
Yeah, so obviously a lot of vouchers have time limits, but it could take less than a week for the whole process to play out, or it could take a few weeks. When it comes to source of income, it's one of our unlike I would say a formal complaint could take anywhere from a year to 2 years, quite honestly. Um, but complaints about source of income and complaints about disability tend to get handled faster because they're just easier to interact with the complainant as well as the respondent.
Thank you. Next. Okay, I actually did have a question. I think it was maybe emailed to you, or it was when she was following up, when Susan was following up with you. It was about the federal, all the stuff happening on the federal level, the policies, the cutbacks, how it's affecting, your agency. And
Mhm.
specifically anything about immigration issues or immigrants.
Sure. There have been really two things, given the current federal administration and how we've been interacting. One, in terms of the human rights law in general, nothing has changed. Nothing has changed for protections in New York City. Um, maybe someone cannot be discriminated against for a job because they are transgender. But if they go, our office faces 26 Federal Plaza on the backside. So maybe they go across the street and apply for a job in the federal government. They could be discriminated against because they are transgender, but that we've never had jurisdiction over federal employment or state employment anyway. So that doesn't really change. But I'll say with immigrants, undocumented folks are protected under the law. They can, as if they have a job, we don't care how they got that job. We just care that they have one. So if they do have a job, they should be afforded the same benefits, the same pay, the same rights as anyone else who's a citizen or can legally work here. And they should not be threatened with deportation. So they do have those protections in employment settings. Similar with housing, landlords cannot threaten to deport anybody. And when it comes to transgender and intersex folks, I know the president put out an executive order, basically saying there's only two sexes. That is not the case in New York City. Our law is very broad in terms of talking about gender and what that includes. So, again, people have those protections here in New York City.
May I do have a question?
Oh, okay, we will have another question from Carmen.
Hi.
Yes.
My question has to do with employment and the current state of things in terms of the height, what is it? Cyber
Height and weight?
or with what's going on in terms of people's information. Who within your department would handle that? Let's say, for example, a former employer takes your file and literally dumps it in the dark web.
Mm. Yeah, that would, so our agency, while there are certainly a lot of bad practices in employment, our agency only concerns itself specifically with discrimination. So if something is happening because an employee or a set of employees are of a certain race or a certain gender or a certain age, and that can be, somehow proven, then someone could file a complaint with our agency. I know we work closely with DCWP, when it comes to sick leave and things of that nature, but that's more under their purview. But if it's related, the practice is related to a protected class or might have a disparate impact on a particular community, then we could get involved.
Thank you. Anybody else? All right, I think that was the end of our, questions.
Oh, can I say one other thing too? I know Ryan Health was on earlier, and they talked about their addiction services. Um, those who are in active recovery for addiction of any sort, that they also fall under disability provision of the law.
Okay, it's good to know.
Yeah.
Okay, so thank you very much.
Thank
And
you so much. I appreciate
have
it.
you sent your presentation to, the office, to Susan?
Yeah, I can do that. No problem.
Okay, that's great. Okay, so thank you.
All right. Thanks.
Okay, thanks for coming. Thanks. Bye-bye.
Okay, so there's two people on that I don't know, so it's someone from CDC.
Okay, it's no one from, Charlie? Or Christine?
That's the one that I.
Okay.
Today was probably also the first day of school. And
Oh, yeah, today is the first day of school.
I sent a confirming email the other day and never got an answer, so.
Yeah, that is the first day. But they should have. Okay, so, let's look at our agenda, but, okay, district needs. I emailed a copy of it to you yesterday. I have a couple paper copies, but if you could open up your email, that would be good. We've updated all the statistics.
We put it up maybe. Or do we need to, maybe we don't need to.
Does everyone have a copy they can look at, on their phone or on their, or take a paper one?
Hopefully, we're not making any changes.
But we're not making changes, so we did a lot of updating, we made the changes that we talked about before. There's a couple of additional, I think of my, okay. We need to, I don't think I need.
We don't need to go through it anyway.
Yeah, we don't need to go through it, we just wanted
Everything you talked about last time.
I just wanted to announce this on before you guys can get it now. So I
No,
know.
leave it, I'll print off your-
Oh, I think it'll just be about 15 more minutes.
Yeah, we won't.
That's a little helpful.
Thank you so much.
Well, look, yeah, we'll call it.
Any questions?
Turn the arrow.
We need a Zoom expert, we need an air conditioning expert.
Oh, thank you.
Do you want to do?
No, we're not.
So security's in the building, and obviously to use the restroom, email is on that side, email is.
Okay, thank you so much.
You have my cards, so I can if you have any questions or.
Oh, they're in their folder?
I can bring some out, and if you want to tour me now to make some time, I'll be more than happy.
Thank you.
So make an appointment, just call me, I'll get it started.
Thank you.
Okay, so,
Are you coming back?
No.
I would say, you want tomorrow is fine.
okay, so you can, so this was emailed out yesterday. Everything is updated, I think, except for there's a couple of, statistics we need to get from Christine and Carrie. Said they would be able to do it one day. Also, we have the story. So I have paper copies because of these. Oh, sure. The story, Larry and Robin helped to get, Robin, they're both not here today. Larry got the quote, and then after that, I got some additional information to sort of align it with the quote. So it's the story of a, mom who's, drowned her nose and the family. So, and I'm gonna have Robin look at it again, to make sure that it's, correct. There was stuff you had to tell me, but, I'm not sure if it was. But I think it is.
Can we get it finished and sent to us Monday?
I think so.
We just need pseudonyms.
Yeah,
So the Maria says is what Larry got, and then I found that we needed a picture of Maria, so the top is the you know, like a picture of the person, is that something? But, you know, in words. So the top is the attempt to, paint a picture of Maria and her family. So is this what we are, I mean, is it too long in terms of
I
space?
think it's a little long now for the sidebar, I think it's cut it down a little bit.
Okay, how much do you want to cut down, let me know?
Well,
Half a page, 1 page, no. You can cut.
anything so, because last time it was like, probably like maybe a quarter, you know, we kind of had it indented with a little screen over the center side instead of the art.
Yeah, it was almost a page, actually, it wasn't quite, it wasn't, you know. It was like a large part of my page. Not only wide, okay. Let's try, okay.
And we have, you have, an idea of where you would want us, what part we should put this in? Maybe you can think about
I
it.
guess it's near the immigration part or the school part, you know, because it's a family and then what experience. And if there's parts you think are not that we can cut, then let me know now, it would just make it easier for me. You know, the quote, I mean, the whole quote is a half a page. So, you know, maybe we only need a paragraph, what's the most important thing that you think that she has to say, but. Can be there. I think that the entire paper helps us get an understanding and context for which is providing her statement, so I feel like all of it is necessary. To me, is like making it sure that is there a word? Just tell me how much space you want, what, I was just talking about. I succeeded that, I feel like the first three paragraphs help us get an idea of the family things. If we just have that part out in the second part, it doesn't really give us an idea of what we're looking at.
So you're saying it should stay in?
Yeah. Might be like, just like spelling, like, long-term as a sensible, kind of all the, but other than that, I feel like it's, I like that we both tried to. But I don't really that story, so
Some of this too can be like, you know, Maria and her family live in, you know, New York, they own a grocery store. You know, like some of it can be a little bit more condensed.
Yeah,
Yeah.
that's what I want to know, that's what I want to know right now. If you want
Yeah.
to condense it, just let me know now, it'll be a lot, you know, if you have ideas right now, just, it could be condensed.
Yeah, no,
Yeah.
I always think less words are better.
Yeah, so just, okay, so what do you want to take out? Just let me know, and then, you know, we don't have to go on serious about it. Since you are
It's
looking
more
at it now.
rewording rather than taking
Yeah,
out the idea.
yes.
Oh,
It's
okay.
more wordsmithing to keep.
Right.
All
because
the
it was
content
Immigration and asylum seekers.
Within,
Good.
Yeah, so to keep all the content, just
Okay.
make it
A little more,
Right.
condensed.
Yeah, if I could just ask on the last sentence of the second paragraph, where it says Maria's husband still needed to work, so he stayed in the US becoming,
And the document.
he overstayed a visa.
That's-
yeah, I think it's just
No.
clarify it, maybe even use those words. I think it just.
He overstayed a visa because he had to work here, because he had to make money to send home to the family, and this was it.
I just think that it's just not clear the way it's worded.
Oh, okay. So you want me to say he overstayed a visa?
You know, after the.
Paragraph.
We should be reworded.
Yeah, he seems like his, okay, Maria's husband is from Ecuador. Okay, cool, we know where they're from. His family owned a store with the victims of extortion. I think that shows why they need to stay here,
Right.
right? Then the father became ill, has been needed. I don't think we need to know that, because I think she's trying to say the grandfather became ill, or
the thought, like that's what.
Yeah,
I think the father's father, yeah, that's why I need the pseudonym, so it's the husband's father. It sounds like, I have to find, I think the husband was younger, and live with the parents. I think.
Yes, I don't think that's necessary as far as their story is concerned. I think the main sticking point is the fact that they were victims of violence in Ecuador, and this is somewhere safe. So I don't even think you need the father and all that other stuff.
Okay, so they were victims, okay, there we go, of violence in Ecuador, and they needed somewhere safe.
Yeah, no, we just leave that sentence. The first one, Maria's husband is from Ecuador. His family owned the store in Ecuador, but they were victims of extortion and the store was burned down. Then I'll just leave it at that. Because that answers why they're here.
Right.
And then going
And
down
then
to,
due to him expiring his visa because he had to work, I mean, you know, sort of like that.
yeah, like,
Just-
and like, yeah,
just
but
let it go.
a friend offered an opportunity to work in US
USA.
temporarily.
Right,
But after his visa expired, he still needed to work, block, still needed to
support his
work,
family back home.
period.
I would say like, after the visa expired, continued working, becoming, becoming an undocumented.
Okay, that's good, okay.
Just leave that like that. The other stuff is just.
And like the two children born in the US, they're school-age children, they have two school-age children?
Yeah, here, born in the US, so that's how they got to be mixed status. because
Right.
The children are American-born citizens, the father is undocumented. I don't mention it here, but Maria has a green card.
Oh, okay.
So I
So
think
she's a legal resident,
Yeah. The
and
husband
he is not,
undocumented,
okay.
but the
That's
husband
fine.
is called- The kids are American-born kids.
Maybe say that she's from the Dominican Republic and legal status.
And has legal
Oh, I
status.
should say that, okay.
Yeah.
Yeah.
She's from the Dominican Republic.
It has
and-
legal status in this country.
Yeah.
It doesn't seem like,
The-
it's a little confusing of like, it's both for the parents, but
Yeah.
it's really not both for the parents.
Right.
It's just.
Fine.
Yeah.
Exactly what it was supposed to be.
Maria and her husband own a grocery store and they manage the store together.
Right.
And I put the thing about the interpreter.
Right.
She's like,
She's
"Well, the
certified
certificate that's actually, certified interpreter is doing."
That's a side hustle, and that's fine.
Yeah, but it also is like something you see, he's serving the.
Maybe she's trying to
Right.
how she's a valued member of
Yeah.
her community. I get what you're saying.
So then the quote is like, do we need all of this stuff or do we want to condense that?
Is this really a direct quote? Do we have to use these direct words? The reason I'm asking is because I think, we say support groups for younger kids would be helpful. I think it would be, if we say, my children need support groups, my children need support groups. I need legal advice, make it more personal.
Yeah, Larry got this, I don't know, it's. Pardon? This was done by Larry, I don't know, but this last part was done by Larry.
Yeah, it seems very impersonal to me. We're using this human story and, people don't talk that way. Support groups would be more helpful. It's like, my child needs a support group.
My child needs help.
Yeah.
That's
Yeah.
basically how they say. it.
My child needs help.
My son is suffering
Right.
from depression.
I need legal advice, not legal advice for those who need blah, blah, people.
Now, let me ask Larry, she may have said that, or you may have like interpreted, I don't know.
It sounds like, I just think all of that just is a lot there without saying a lot of different things, and I think was more personal, but this is what I need because of this, this is what I need because of that.
Okay.
Or really, this is what I'm going through, and it
Yeah.
comes to paragraphs. I'm not connected to it, but I can understand her struggle a little bit more from the first three paragraphs. And I think if this is her quote, maybe summarizing it a little bit better than, like you said, maybe more personal things. I feel like it's just more like, a blanket statement, not really like what she's really going through and why she's.
I mean, the whole point of this is.
No, yeah,
mean, it's
no,
something,
I
yeah.
think, like the first paragraph. It may be in translation.
Yeah, that's what I'm saying.
Yeah, from the
Probably
Spanish
right,
to
yeah.
English, in which it probably was more heartfelt
Mhm.
in her native tongue.
Yeah.
And he was just trying to translate it so that it's, because I think a lot of the elements, make make a lot of sense, but getting to the part where, okay, for instance, this was my thought. The anxiety the child is feeling is the fact that he's thinking about his parents when he's separated. But the way it's worded is all the way down to the bottom, so you gotta get the understanding of, you know what I mean? Like if you're saying, my child needs help.
My son is upset, is
Right.
scared. My son is scared because he's afraid we're gonna be separated.
That's, I get that.
Yeah,
The
this
way
is, the-
this
this
is
is the
worded, I was
translation.
like, I'm confused. But that I get, like my child is scared, like she said, my child needs help. And then with the, first working family, we can just kind of, we suffer from anxiety. So it's not only just the child, it's our whole family that's suffering from anxiety, including my child.
I don't think we need to use exact words because we're not using anyone's name.
Right.
You know, we're not saying Eric said this and
Right,
then
right,
changes
right.
words.
Okay, so we can word this to get the intent to feel of this.
Just make it personal. This is what's happening to my child. This is what's happening to me, which is kind of the whole point of this.
Right.
Paragraph of the quote.
You say one paragraph?
The third one of the quote, what do you think? In the quote,
That's, again, it's like, that's not human. Please think about people who have been living here many years and give them some life. I mean, that's not a personal thing, and I don't even know what it means.
okay, so we should cross it out loud. What does it think?
Yeah, I don't think that's, how can they become, you know, if someone's saying, I need housing, they're not saying, how can they, who's they, become permanent without being in the shadows? I mean, it's. Yeah, I think we just need to just reword it as someone saying, this is what I need, this is what's happening to me.
Yeah, I haven't talked to Larry in like. He's been out,
Probably still away,
yeah, he's still away, so I haven't been able to talk.
but we could just fix it out.
Okay. I did email him, so if you see this, you know, but yeah, we'll just let him know. Okay, okay,
That's it.
anything else on this? Okay. And what is it? We looked at tab reports? Yeah, tab or CEC reports, anybody?
Here meets on Monday,
Who meets on Monday?
moving in.
Who meets on Monday?
So
Okay.
next month.
And the CDC had, but I've been sitting on for a long meeting, bring that.
Okay, all right, okay. Susan.
Wait, I'm sorry, there is nothing to report?
Yeah, I was in transit from North Carolina, so I heard some of it,
Oh,
but I know I can just report that they had a meeting,
which one? I'm
the
sorry.
CEC,
Okay.
they had a meeting.
No, that's it.
Yeah.
And Eric says Gouverneur will have a meeting this coming Monday.
Correct. And now it's all in person. Just,
Oh,
It what's the was- it's gonna be at moving there on the 12th floor. At 6 o'clock.
I think it's the fourth floor, they're going to the first and then the one.
Street side is the best.
Okay.
Skilled nursing facility.
Oh, okay, okay.
all right, okay.
I'm not going.
Okay, just a little bit about next month. Our meeting will be in October. We
I
will
won't
be.
be, here. I don't know where it's gonna be, and I will,
Let
let me see. No,
If
it's
you go
right
to
there, the
Wednesday,
week
right?
before, no, I will not be here.
Okay.
Oh, great.
All right.
Thank you. I'm getting a highly low permit first. You notice that I've lost a lot of weight because I can't eat. It's not because I've been being good. So I'll maybe do it like Manny Canner or something like that, you know, where we.
Oh, not in the office, I mean, okay, so, but the office will.
I don't know who, if anyone will be there to do everything.
No, in terms of arranging the meeting space.
Yeah, oh, absolutely.
Yeah, you guys, right?
We do that way.
Okay, okay. But in terms of their, okay, so just let me know what room it is as.
Yeah, we'll start, we could actually start next week, we start trying to get meetings.
Okay, just let me know and I
It kind of depends on often what's at the, what we're gonna have, where we're gonna be. And I don't even know, like, I guess the bigger question is, other than budget, should we just have budget priorities, nothing else? That will be the whole meeting? That's probably enough, right?
Yeah, that's a lot, yeah, that's a
So-
lot, unless something comes up
so,
like, or,
and-
time sensitive that we need to. do.
As it stands now, the agenda item will be budget priorities.
It's the same for every other committee as well, right?
Yeah,
Okay, and
but
we're
yours is much more, you have like 10 times more than anybody else.
okay.
The good news is none of this balancing anymore between seniors and children. We don't ever have to do that again. It's each agency gets their priorities. You don't have to pit kids against seniors.
Well, I just love that.
So what, maybe you can explain to me exactly what it is, or you can do it later, but.
Well,
Well, is that explained now?
so we're going to not have one list of priorities. You're gonna have a list for every agency. You're gonna have a list for ACS. You're gonna have a list for DOE. You're gonna have a list for DHS. And so all you gotta do is rank them within that one list. You're not gonna collate the list.
And, in terms of the whole board, you get a certain number, like basically like 25.
Generally, they're not strict, everything changes with every administration, so they're not as strict. But it's generally 40 capital and 25 expense. So, and most of the expense, a good portion of from this committee. But, it's like we can't have 100 under each agency.
Right, yeah, okay, so that's similar to before. All right.
That's
Oh, okay, and people should remember that the full board meeting is on Wednesday, right?
Yes, because it's a religious holiday.
Right.
It's a religious holiday.
Tuesday is a holiday, the school is, it's also closed on Wednesday.
The school is closed on both days, but they're opening it for us.
Okay, so just remember that the full board meeting is on a different day. Same
Thank
place,
you
but
for
different
remembering
day. And you have it, you just look on the calendar and you have it. Okay. All right, so now we will have final roll call.
Bailey,
Here,
Larry absent, Eric.
Yes.
Here. Taisha here, Naima, sorry. Ramaya, Anna, absent, Robin absent, and Johnny present. Arnett here, Carmen.
Present.
Oh, wow.
I didn't more fun.